Good morning. Today I am going to study medical surgical nursing. The topic is tuberculosis. First, first of all, definition: tuberculosis is an infection. This is usually caused by the bacterium Mycobacterium tuberculosis. The tuberculosis generally affect the lungs, but also can affect the other part of the body, including lungs, pulmonary, extrapulmonary, kidney. These are collectively denoted as the extrapulmonary tuberculosis. The tuberculosis types of the first one, pulmonary. Pulmonary, if a tuberculosis infection does become effectively, it most commonly involve the lungs in about the 90% of the cases. Then other, second one, extrapulmonary. Extrapulmonary, it means in a 50 to 20% of the effective cases, the infection is spread outside the lungs, causing other kind of the TB. These are the collectively denoted as the extrapulmonary tuberculosis. Next one, etiology. How to cause in a TB in a human beings. First one, Mycobacterium tuberculosis bacteria infected agent. These agents are spread in a body, cause the tuberculosis. Then pathophysiology. First, infection enter in the human body, then exposure to the source, aerosolization and inhalations of the bacteria leads to the reach in the lungs bacteria multiplications in a inflammations in a tuberculosis, then caused by the tuberculosis. Next one, clinical manifestation. First one, fever, chills, night sweats, then weight loss, fatigue, weakness, immunodeficiency. Then next one, diagnostic evaluation. CBC it means complete blood count will be counted. Next one, Montex test tube test. These tests are the detect of the tuberculosis. Next one, chest X-ray, PFT, pulmonary function test. Next one, prevention. How to prevent the tuberculosis? First one, tuberculosis prevention and control efforts rely primarily on the vaccinations of the infants and the detections and appropriate treatment of the active cases. First, at the birth time of the baby to prevent BCG vaccine to prevent the tuberculosis. Management, there are so many types of the management. First one, medical management. Second one, surgical management. Third one, the nursing management. First of all, medical management. Due to the resistance that is the developing against the anti-tuberculosis medications, combinations of the therapy of the 2 4 medications at the time is presently recommended, because these medicine must be taken of the 6 to 12 month. Medication and non-compliance is a significant the contributing factor in a development of the resistant strain of the TB. Then the current 4 medication regimen include isoniazid, nitrazide, rifampicin, pyrazinamide, and the ethambutol hydrochloride. These are the medicine prevent to the tuberculosis. Second one, nursing management. Nursing management are the important management for the TB. First one, administered of the oxygen therapy prescribed, then prevent the infection, nosocomial transmission, then use the barrier protection when the risks of the hand or clothing contamination of the exit. Promote the adequate nutrition to the patient, then intake of the water, then to provide the healthy environment to the TB patient. Proper use of the protocol, especially in the infected patient, proper hand washing, these are the prevent of the tuberculosis. Thank you.